I'm worried my baby might be constipated. This is a question I often get asked. My name is Professor Caroline Fertelman, also known as Dr. Carly. I have over 30 years of experience working as a paediatrician with children, and I'm a parent of 3 now adult children. I see a lot of babies with constipation, and it's a topic that's commonly asked because the range of normal is so vast. Babies can poo from 12 times a day, normal breastfed babies, to once every 10 days. So constipation is the infrequent passage of hard stools, sometimes so hard that it can cause little tears and small amounts of blood. But actually normal babies, if they only open their bowels once every 10 days, people can misconstrue this and think that this is constipation when actually it's just the normal for the baby. And what they do pass after 10 days is soft and doesn't cause them any pain. So it's something I want to try and empower you to do, which is to work out what you think your baby is. Is your baby actually constipated, or are they just at the sort of end of the normal range, which is they only open their bowels once every 10 days? If they're passing very hard poos, then that's a different matter, and you may need to do some dietary alterations to your own diet if you're breastfeeding, or you may need to add in a laxative if you're bottle feeding. You'll need to seek medical advice for that. But if your baby seems to be quite happy and growing well, passing urine normally, developing appropriately, smiling at 6 weeks, etc., then you don't really need to worry if they're only opening their bowels once every 10 days or once a week, if that is normal for them. And I think you'll know that. You'll look at the baby and you'll see, this is a happy, contented baby. I'm able to settle this baby. He doesn't seem to be in too much pain the week before he opens his bowels or her bowels. This is just how he is. But it may be there's a change in bowel habit, and that might concern you. And babies do sometimes go from frequent passage to less frequent. Sometimes it's related to what you eat. Sometimes, who knows? It's something in the wind. But I think you'll know when your baby really does have constipation with really hard stools that are painful and really hurt to come out, or they just pass stools less frequently than another baby that you might see. So see how your baby is, how you feel your baby is, and whether you do need to seek medical attention or whether you think you can manage it by yourself.